nervous tissue this week. This is our fourth tissue. We talked about epithelial tissue, which covers, connective tissue, which connects, muscle tissue, which contracts, and we'll finally get to nervous tissue, which communicates. So we'll be finishing the four major tissues this week. Your next quiz is on Monday, 1 week. Next quiz is on Monday next week. Your next practical is Monday or Tuesday, depending on your lab. So, yeah, exciting. So please check the announcements. I posted the study guides and topics. We have open lab on Friday. I'll post the specific hours. It might be adjusted a little. I've got a meeting that afternoon. Yeah, and we are dissecting this week, so that's going to be fun. I feel like you're more excited about that. Okay, great. So yeah, that's got a lot this week. Question?
Will we get a lot of hands-on?
Sorry guys, I can't hear Jody. You could pay attention to her, please.
In lab, are we going to be able to get a lot of hands-on of the muscles so we're ready for our practice?
Yeah, in lab, are we going to get hands-on time with the muscles and dissection? Yes. So we already have half of other classes have it in prone position. So we have the back muscles already dissected. We're working on our cadaver, which is in the supine position. So we're going to work on the anterior muscles.
Okay.
And already half of it's been dissected. So yes, you're going to get practice of dissection and looking at the muscles. That's the goal this week in lab. Other questions?
This week or today on Monday, Wednesday?
All this week. Monday, Wednesday, all this week. Other questions before we get started? Okay. So you're talking about axial muscle. You remember when we talked about axial skeleton? That was the skull, that was the spine, that was the rib cage, thoracic cage. Here we're talking about the muscles that are attached to those things. So we'll be talking about muscles needed for facial expression, muscles for chewing. Mastication is just a fancy word for chewing. How to maintain your posture, sitting up straight. Breathing. Breathing. All those different muscles needed for keeping your axial skeleton in line. When we get to lab, we're going to see those muscles both on models and on the cadaver, and we'll be identifying those. So, your muscles can be stimulated with electrical things. I don't know what to call those electrodes. They can be stimulated by electricity. There's this one weird experiment, I guess really cool and interesting experiment that they did, I don't know when, 1800s. This guy's not voluntarily making these faces. They're stimulating muscles on his face, and when they're stimulated, it's contracting. Because we learned that neurons release neurotransmitter, neurotransmitter binds receptors, causes electrical signal, causes contraction. When you stimulate a specific muscle, that'll cause contraction, and if you contract certain muscles, it causes your body to do certain things. Here we're stimulating muscles of the face, and it's causing certain facial expressions. So what we're going to be focusing on a lot, my main focus is not going to be so much the insertions and origins. Those will be important to know and like where they're attached to. I want you to understand how muscles, when they contract, what movements they cause. Whether it's causing movements of your face, of your jaw, of your limbs, whatever. We learned about the movements in the previous section. I want you to keep those terms, don't lose them. It'll be really important. We're using those terms to describe the movements that those muscles do. In general, what are axial musculature? What is it important for? They're found in your head and neck. They're found in your vertebral column, thoracic cage, abdominal pelvic walls, where you expect your axial musculature to be. But these are the four things that we're going to be focusing on. Axial muscles are needed for expression of your face, for chewing and swallowing, so that's going to be found in your cervical neck region and mouth, mandible region. Posture. Breathing. We went over every single bone, pretty much all the major bones of the skeleton. We're not going to go over every single muscle. There's a lot. We're not going to go over every single muscle. So the ones I go over here are the ones we're focusing on. And those are highlighted also in your study guides. So you have to take a look at that. Please take a look at that. Okay. Muscles of facial expression. What are some muscles that we use for facial expression? Let's start with the anterior side, anterior superior. Right on your frontal bone is your frontalis muscle. Right on your frontal bone is your frontalis muscle. When you contract it, what you do is you raise your eyebrows and it ends up wrinkling your forehead, like kind of like a surprised look. Frontalis. Raises your eyebrows, wrinkles your forehead. That's right on the frontal bone. Makes sense, frontalis, frontal. You have one right here in the back. This is your occipital bone, so this is your occipitalis. Your textbook might call it something different because these two muscles are actually connected to each other. So it might have a name like fronto-occipitalis or something like that. We're just going to stick with frontalis and occipitalis. They are connected though. They are connected by, does anyone remember the term for, when it's connected muscle to bone, that's a tendon. What is this muscle to muscle? Aponeurosis. There is an aponeurosis between the frontalis and occipitalis. What connects them, we can call that, it's on top of the cranium, so this is the epicranial aponeurosis. Again, it has nothing to do with the nervous system, even though it has that term neurosis. People just thought it looked like nervous tissue early on, so the name stuck, unfortunately. When you contract your occipitalis, the muscle all the way back here, that moves your scalp back. I'm not very good at contracting that. I don't know if anyone's good at that. Probably automatically. So, two major muscles, frontalis, occipitalis. This is a fun name. This one's called corrugators supercilia. Has you ever heard the term corrugated before? Where have you heard that term before? Metal or cardboard. If you see those like the roofs of certain shacks or houses where it's all jagged like this, or a cardboard, when you have a cardboard box and you start ripping it apart, you see the middle part's kind of wavy, that's corrugated. So this muscle is wavy, and it's super, what direction is that? Up. It's above, we've used this term before, the cellular level. What are cilia on the cellular level? What do they look like? They look like hairs. It's a corrugated, wavy structure that's above your eyebrows. Corrugators supercilia. It's here. So this wrinkles your eyebrows when you contract them. Gives you some worried, sad eyes. Yeah, we're making funny faces in this today. So yeah, on our diagram, it would be above here.
What about the finger?
Sorry? Well, the muscle's here, and when you contract it, it can be brought in. I don't think there's a muscle like right in between.
That's why they're always
Yeah. Surrounding your eye. The word for surrounding or orbiting, orbicularis, so that's a circular muscle. Remember we learned about shapes? Circular muscles help regulate the opening and closure of something. Orbicularis oculi, surrounding your eye, oculi, like ocular. Questions on these muscles? Straightforward? Yeah, that closes your eyes. Orbicularis oculi. All right, how about some more? Moving a bit more inferior. If this is the bottom of your lip, this is your lower lip, extending slightly laterally, so at a diagonal, right here. This is your depressor labii, pronounce the I twice, labii inferioris. Depressor, it lowers the, it lowers the lower lip. It depresses the lower lip. Depressor labii inferioris. So when that contracts, it pulls the lip down. We can move our lips in a lot of different ways, so that's just one of several muscles that move our lips. That lowers the lower lip. If we want to raise the upper lip, there's this muscle that extends from like this slightly lateral portion of our lip all the way up towards the eye region, towards the orbit. Shown right here. That's levator labii superioris. It raises the upper lip. Levator labii superioris. We had orbicularis oculi surrounding the eye. We have orbicularis oris surrounding the mouth. Orbicularis oris surrounding the mouth because it's the oral region. Orbicularis oculi is surrounding the ocular region. Orbicularis oris, orbicularis oculi. That's right.
That was like some of the few circle muscles.
It is another circular muscle, yes. It's another circular muscle. It's regulating the open and closure of the mouth.
So when people say that, like, you use less muscles to smile and it takes more to frown, which muscles do you use for?
Which muscles you use for smiling versus frowning? Does it really take more muscles to frown than to smile? Hopefully we can answer that once we get through these. We're going to look at the muscles that you use to smile versus make sad or frowning faces. There are two major muscles for smiling. We'll get to them on the next slide.
We have only two muscles that are
Muscles that are. We're going to learn about muscles for.
just because we're looking the muscle tissue, like only the mouth and eye have a circular. And then I was thinking only these two muscles are circular or just
Are these the only two muscles that are circular? The orbicularis oris and orbicularis oculi? They're the only ones on the face that are circular. There are other muscles throughout the body, namely sphincters, that are circular, but these are the major ones in the face. Okay. This answers the question, Adela. How do you make happy or sad faces? There's this muscle on this lateral portion of your buccal region, your cheek. You can see it's hiding under here, so it extends across your cheek this way towards your ear. It's called the buccinator. Buccinator. It's in the buccal region, so hopefully at least that much will help you remember. But like if you're sucking through a straw, the face that you make sucking through a straw, or if you're blowing a trumpet, those muscles to like really, I don't know how to, yeah, do those motions. Do those motions. You need the buccinator. So really like tightening your face and using a lot of force. Buccinator. Mentalis, you know the mental region, that's your chin. So this muscle, it's cut here. It's right on your chin. The two of them converge together here right at the base of the chin. Mentalis, mental region. This, when contracted, it helps protrude your lip. So it's when you pout. You pout. Yes?
Are the majority of the muscles in the face parallel shaped?
Are the majority of the muscles in the face parallel? Yeah, they're mostly parallel. Trying to think of any. I can't think of any major example that would be different. Besides the circular ones, they're all mostly parallel. Yeah. Here are the two major muscles. I guess three. Here are the three major muscles for smiling. Risorius. This is a thin muscle that starts on the lateral portion of the lip and then also extends laterally towards the ear. It's more lateral. So it's like if you do a fake smile or something. Yeah. That's risorius. So that brings it laterally. Or it also helps you purse your lips. You want to purse your lips like that. That's risorius. If you combine that with these other two muscles, and this really are the major muscles for smiling. If you combine this with this, then you have a really big smile. Zygomaticus major and minor. We're going to be learning about a lot of muscles that have a minor version and a major version. What do you think is the difference between the two, major versus minor?
Major is
Major's bigger, yeah, major's bigger. Typically, do you think you'd find the bigger muscle inferior or superior? Which one do you think has to move more? The one lower down or the one higher up?
Lower down.
The one lower down, because of gravity, we have, yeah. In general, the major is inferior to the minor. In general, so this is true for zygomaticus and also true for other majors and minors that we'll be learning soon. In general, the major is inferior to the minor. So there are two muscles which are right here. Here's the minor, it's a bit more superior. Here's the major, and guess what bone it connects to? Zygomatic bone, and zygomaticus major or minor. They pull the corners, you can see how they're more diagonal, they're not as lateral. They pull the corners of the mouth more lateral and it's superior.
So you have one on each side, so are those singular terms or plural terms?
Is this a singular or plural term? Zygomaticus, that's singular. How would you say this plural? That's a good question. I never really thought of that. Because they already got. I have to look into that. I've never really thought about that. I always just say your zygomaticus muscles. I just use the plural as muscles. Good question though. I'm sure there is a plural version. I'm just going to say zygomaticus muscle. I'm glad you would say that. So these are the major muscles of smiling. They pull it more diagonal. This would make a bigger smile, but it's more lateral. Risorius, zygomaticus. Platysma. You may have seen this root before, platy. You know of any word that has this? The platypus. What's unique about a platypus? It has a bill. There are monochambers. That's not important. But yeah, they have bills. They have like duck-like bills. Duck bills compared to other beaks. How would you describe duck bills compared to other beaks? Flat. Platysma is a flat muscle that goes from your mandible down your neck. Why don't you do this? Yeah. This is your platysma. A large, broad, flat muscle here. Platysma. This helps you depress your lower jaw. Or if you're like in shock or surprise, that helps you. I mean, that's a lot of muscles are working, but that's one of the muscles that are doing that. It's, yeah, extending from the mandible down here.
Does it connect with your clavicle?
Yeah, connects to the clavicle. I realized I ran out of space with this, so sorry about the writing. I guess my facial expressions are more questions? All right. These are the major muscles of facial expression. There are a few more muscles of the face, which are more important for chewing. We'll go to that in a second.
So for frowning, are they the same muscles as smiling?
For frowning, is it the same muscles as smiling? No. The major muscles of smiling are these three. For frowning, you would You could use your platysma, you could use your mentalis, your orbicularis oris, several more. So you use like, you can simply use 2-3 muscles for smiling. You use all your muscles a little bit when you make facial expressions, but you at least need 3, and then there's a lot more that you can use for the front. Yes?
So when you talk about like function with like, so what is the function of smiling? Like I know it smiles, but like what does it act, like why was that?
What's the function of smiling? You're talking about like evolutionary reasons?
Yes, like why would that?
That's getting to more anthropological discussion, which we can debate more later, but I guess my brief answer about this is anatomy class is, I mean, we just want to communicate how we're feeling in general. Like if it could be advantageous to stay away from someone that looks angry, or if they're going there, you know, this sounds like a threat. If someone's happy, like, you know, they're probably happy about something, you want to get on that too. That's my guess. All right, how about for chewing? Again, our fancy word for chewing, mastication. Mastication. Four major muscles for chewing. There are 4 major muscles of chewing. The 2 larger ones are masseter and temporalis. Masseter is your most superficial one, and it's right where you'd expect it. It's going more inferior. The fasciculars are running longitudinally this way, superior to inferior. The most superficial, your masseter. Since this muscle, when contracts, it shortens, would that open or close your jaw? Close your jaw. Most of these muscles, minus 1, we'll talk about that in a second. Most of these muscles, 3 out of 4, close your jaw. So the masseter is for closing. You can just relax your mouth, your jaw muscles if you want to open it, but this one actively. So masseter is your most superficial, it's right in your buccal region. Temporalis is up here, around your temporal bone. That's temporalis. This is your temporalis muscle. This is the strongest muscle, which also makes, of your chewing muscles, which also hopefully makes sense. If you want leverage, you don't want to be right in the area where you're chewing, you want to be away from it and then pull up. So you can get the strongest clench. Don't chew too hard, but you can feel this muscle when you chew. Don't hurt your teeth. This temporalis muscle contracts when you chew. Strongest muscle of the temporomandibular joint. Is this muscle superficial as well? Yes. Yes. All right, this fun word here, pronounced pterygoid. The P is silent, like pterodactyl. P in pterodactyl. Or Ptolemy, anyone who's a Greek fan? Greek. Pterygoid. The P is silent. Pterygoid. I didn't stress this, but does anyone know what the pterygoid is? It's a feature on a specific bone. Does anyone? The what? The sphenoid. Yeah, the pterygoid is a feature on a bone, the sphenoid bone. So it attaches to the sphenoid. That's why it's called the pterygoid. And you've got medial and lateral pterygoid. Okay, where do you find these? I'm sorry? Okay, so if you reflect the masseter, so these are deeper muscles. If you reflect the masseter, you can see the lateral and medial pterygoids. You can see the laterals going more from like the cheek region, the zygomatic region, and the medial pterygoid is more longitudinally up and down. So lateral is more superior and more horizontal. Medial is more inferior and vertical. Because the lateral pterygoid is more horizontal and more external and superior, It doesn't it doesn't close your jaw like the rest of these do. It opens your jaw. The lateral pterygoid opens your jaw. So you can force open your jaw with this muscle.
You said the lateral was more horizontal.
Lateral is more horizontal, more superior. It's for opening your jaw. What's a word for opening your jaw, this joint? Depressing. Depress your temporomandibular joint. Compression of the temporomandibular joint. Yes?
The ones that you have on the board are those the ones that we need to know for the test, or do we need to know all of them?
I did get a chance to write the rest of them. Everything here in bold is going to be,
Got it.
yeah. So lateral pterygoid is for opening. Medial is for closing, and also protruding. I don't like doing this, I'm not going to do it, but if you bring your jaw out, you're using your medial pterygoid. Kind of hurts when I do it. Medial pterygoid is for protrusion and closing. Protraction, yes. Protraction. Okay. Return one more time. Take a moment. Raise your hand a few more times. Okay, let's hear hands. 1, 2, 3. Cool. Find someone with a different answer. Argue while you're right. Go ahead, 1 minute. You guys think? When the where's one counts? Right here. When it contracts, we control it. Oh, sorry. We want to know what lowers the eyebrows. I think you're right. What do you think? So you think it's C? So if you relax this, it lowers it. Okay.
I think purple lowers.
What do these normally do? It's like, yeah. So, well, lower the eyebrow, lower the muscle.
They might inject it.
Just tell her why you think it's C. But you tell her why you think it's D. Like, so normally your eyebrows can do it when you want to do better with eyebrows. So what normally... So the thing is, like, you want to paralyze the one that's needed to lower. Yeah. You're paralyzing the muscle that's lowering. So frontalis you said raises. So we need to find a muscle that lowers All right, one more time, please. Hopefully you read the question a little more carefully. One more time, let's hear hands. 1, 2, 3. Okay, we're still a little mixed. So let's talk this over. When you inject into the muscle sorry, let me just read this middle portion because this is the most important part here. You want to inject Botox to paralyze the muscle needed to lower the eyebrows. So we need to figure out which muscle depresses, which muscle lowers the eyebrows. We talked about several muscles that move the face. Frontalis raises eyebrows. Corrugators is going to be, corrugators is going to be bring it back down. So we're wrinkling it, bringing it down, like sad eyes. So how I asked my question, you want to paralyze muscles that are needed to lower the eyebrows, it would be B. Orbicularis oculi is for closing your eyes, orbicularis oris for closing your mouth. So those aren't relevant. Frontalis would be raising eyebrows, D would be for lowering.
So frontalis, like when it contracts, it raises the eyebrows.
When the frontalis contracts, it raises the eyebrows.
So when it relaxes, yeah, so when it relaxes, would that be extending and that would be lowering it back down? I guess that was, that.
So if you paralyze your frontalis, what would happen? If you paralyze your frontalis, then you can't
Go up.
raise your eyebrows.
Okay,
If you paralyze your frontalis, then you can't raise it.
I see, you would prevent it from contracting.
Right.
I see, okay, that makes sense.
Cool. Any more questions? There's another question. One more. Sure. I can answer now. If you relax this, if you have a worried look all the time, it causes wrinkles. If you have a worried look, it causes wrinkles. Where do they? Well, that's different for headaches. Botox for wrinkles is different.
But I can't put my forehead. I raise
This one's actually more about This is probably, yeah. Raise your hand a few more times. Okay, hands up, three, please. 1, 2, 3. On. All right, on 3, say the letter. 1, 2, 3. B. B. Because I had you talk. It's B. B is in boy. The largest muscle for chewing, where you have the most leverage, is right here. Temporal bone, temporalis, would be in the temporal fossa. The other ones, like the masseter and the pterygoids, are down here, so they'd be around the mandibular condyle, the mandible, the angle. The sphenoid, those would be pterygoids. Not those. The largest one, which can cause lots of headaches if you tense up a lot, that's the temporalis. Cool. So those are all the muscles of the face that I want you to know, but there's a few more here in the neck region that we'll at least discuss a little bit. There's a ton of muscles in your neck. I'm not going to go over them just for the sake of time. The one thing that I do want you to know about these muscles is their function and what they attach to. Function, swallowing, and tongue movement. These muscles attach to your hyoid. Remember that floating bone right here? Attached to your hyoid, shown here, and to your thyroid cartilage, which you can feel the protrusion of it. That's the Adam's apple. So in that region, the muscles that are attached from there, that are attached at either one of those, to your tongue, to different parts of your throat, they're needed for tongue movement and swallowing. So I'm not going to ask you to know the names of these muscles. I do want you to know that the ones attached to hyoid and or thyroid cartilage are used for swallowing and for tongue movement. Tongue needs some anchor so that it can move around. Yes?
So like, what kind of question would you ask?
What kind of question would I ask? Let's say you have damage to your hyoid. functionality would you have trouble with? Or
If you gave like a name of a muscle and said it attaches at the hyoid.
yeah, if I gave a name of a muscle that you've never heard of, but I said it attaches to the hyoid or thyrocartilage, what would be important for it? Something like that. Okay, but I do want you to know these attachment points, and obviously from that earlier question, you shouldn't forget names of bones and bone features, because they're going to be relevant coming up. Hyoid, thyroid cartilage, muscles attached to them for swallowing. All right, two muscles you should know. Names muscles you should know. These muscles can actually fit into both axial and appendicular because they do help stabilization of your arms. But we're going to talk about them now because they also help stabilization of your neck, your vertebral column. The sternocleidomastoid, it's a fun one. Sternocleidomastoid. It has these three roots in it because it attaches at three places. It attaches to the sternum. Cleido, any guesses what cleido is referring to? Clavicle. And the mastoid. It's a mastoid process. Where's the mastoid process? It's right here. So we're forming a triangle basically. From the mastoid process to the sternum, and from the mastoid process to the clavicle. So it's this muscle, kind of lateral of your neck, running all along the side. It helps with lateral flexion, and rotation in your neck. Sternocleidomastoid. Your trapezius, if you know this word, we've learned a lot of trapped names like trapezium and trapezoid. And here's yet another, trapezius. This is the muscle that's extending all the way from the neck all the way down to the back, and we'll get to that later. I guess you can see it best here. Here's one half of the trapezius, the other half is on the other side. This is to help you extend your neck. So sternocleidomastoid is for flexion, trapezius is for extension. What's a term for muscles that do opposite things? Antagonists. These are examples of antagonists. One flexes at the cervical region, one extends. It also helps you elevate your scapula. Trapezius also helps you elevate your scapula. What joint are we moving? Not the glenohumeral. Acromioclavicular. We're moving the acromioclavicular joint when we shrug. Sternocleidomastoid. Cool? Questions? Okay, for breathing, what muscles do we need for breathing? Major muscle breathing, if you hopefully remember the first day class you did in lab, the diaphragm. The diaphragm is a skeletal muscle. We can breathe, obviously, without thinking. So it's one of those exceptions where we don't need to think about it, but we can consciously breathe. We can consciously use our diaphragm. If you meditate, if you do yoga, you know what I'm talking about. It's this, shown here is the diaphragm. So it's just following that ridge. You know how our ribs form that costal margin? It goes up. At rest, the diaphragm is curved. Draw this up for you. At rest, the diaphragm is curved. When we contract, it depresses. So it goes here. It flattens out. So this is at rest. This is contracted. At rest, the diaphragm is curved up and into our thoracic cavity. When you get ready to pump something, like if you're using a bike pump, first you pull out, right? You pull out to bring air into the pump. Pull out to bring air into the pump. So if you flatten out this muscle, is that breathing in or breathing out? Breathing in, it's inhalation. When you contract the diaphragm, when it flattens out, that's inhalation. You're making the space of the thoracic cavity bigger, and that allows air to flow in. And we can talk about the physics of that later, but that's the gist of what I want you to know. Make the space bigger, air will flow in. When you relax, then air pushes out because the thoracic cavity gets smaller. Yes?
Two things. When we breathe, our rib cage like expands, right?
Yeah, when we breathe, do our rib cage expand? Yes. And that's thanks to the sternocostal joint, which is what kind of joint? Most of the sternocostal joints, so ribs 2 through the rest, are synovial. These synovial joints allow our thoracic cavity to increase in size when we breathe. Yes.
And then the second one was like, what's the difference in like our diaphragm when we do like chest breathing and stomach breathing?
What's the difference between chest breathing and stomach breathing? Stomach breathing is just with your diaphragm.
Okay.
Chest breathing is when you use other muscles. So hopefully this will answer that. When you breathe normally, as you hopefully all are right now, you're not in a panic or anything, you're just breathing with your diaphragm. That's called normal quiet breathing. If you need to breathe harder, you're exercising, if something's happening, whatever, if you need to breathe harder, you use more muscles. Diaphragm is just your basic muscle for breathing regularly. To force inhale, you need several muscles. You use your diaphragm, of course, that helps you inhale, so it flattens out. You use your sternocleidomastoids. Your sternocleidomastoids can increase the size of your thoracic cavity by pulling up. So we can breathe with your neck even. There's these other muscles called the scalenes. I'm not going to test you on that, but just so you know, there's another muscle here. But these muscles I do want you to know. External intercostals. They're superficial, they're external. They're in between the costals. What does costal mean? Ribs. External intercostals help you breathe in. To breathe out, to help forcefully breathe out, you use a different set of muscles. The diaphragm is not for breathing out. When we relax, that's when the diaphragm relaxes, that helps with breathing out. But if you want to force breathing out, you use your internal intercostals. So you have a second set, which is deeper to the external. Your internal intercostals. And you use your abdominal muscles. And there's several abdominal muscles, which we're going to go over. That's why if you laugh a lot, you start hurting your stomach, because you're contracting these at a high rate. So these are for inhalation, these are for exhalation. External for inhalation, internal for exhalation. Yes.
Are the externals superficial to the actual thoracic cage, or is it?
Are the externals superficial to the thoracic cage? I wouldn't say that, no.
Is it still within?
It's still like, it's attaching from rib to rib, and it's in between the ribs.
Oh.
So it's not on top of it, it's in between. But there are two sets of muscles, and one more superficial, external superficial.
For the diaphragm, just for testing purposes, are you using it as involuntary or voluntary muscle?
Is the diaphragm,
Because you can know, so what?
it's it's both. The diaphragm is involuntarily controlled when we don't think about it, but we can also think about it.
Just figure that out.
I'll be clear.
To be clear, for inhalation, it's when it's the external muscle. When it's the internal, it's
Yes, to repeat that, to breathe in, to inhale, you use your to forcefully inhale, use your external intercostals. To forcefully exhale, use your internal. And Jody, to also be further clear, for normal quiet breathing, that's diaphragm. For these other muscles, that's, you have to think about it. Or it's not always thinking about it either. You can even use these muscles without thinking about it. Just say you're running, you have to think about breathing. You
Just do it.
Do it. And we'll go over that process when we get to the nervous system.
Can you repeat the diaphragm, what's considered contracting is not?
Yeah, the diaphragm. Now let's use my drawing. The diaphragm, when it's relaxed, it's up and into your thoracic cavity. When you contract it, you flatten it out.
So
this
when
is
you
the exact
breathe
opposite.
in, you flatten the diaphragm.
When you breathe in, the diaphragm flattens out. Your stomach should get bigger. So if you're belly breathing, the stomach gets
Okay.
bigger because your diaphragm is flattening out. Yeah, if you're belly breathing, if you're doing diaphragmatic breathing, your belly gets bigger. Your stomach gets bigger because your diaphragm is pushing down. Pushing down. Making more space for air to come in. Cool. Any questions? Any other questions? I just said abdominal muscles here, but we have a lot of different abdominal muscles, and of course, we're going to go over them. So here they are. Muscles of the abdominal wall. There are 4 on this anterior and lateral sides that I want you to know. There are 4 abdominal muscles. The main ones that you think about when you think about a six-pack, that's the rectus abdominis. Rectus abdominis. You can see them here. They do have these intersections. I'm not going to ask you to know them, but they do have tendons between them. That is the six-pack. But rectus, does anyone know what rectus means? It's actually right there, right? Rectus means straight. Rectus means straight. So you're going to see that term a lot because a lot of these muscles are straight, they're parallel. It's an abdominal muscle and it's straight. Rectus abdominis. Straight muscles going up and down. When you contract them, what's happening at this joint? So flexion at the, what joint is this? Femoroacetabular, as well as the lumbar Z joints. But yeah, you're flexing at the lumbar Z joints and femoroacetabular joint. You have 3 sets of oblique muscles. So 3 sets of muscles on this lateral side, and they're layered. So the most superficial layer, you can see it's cut away here. The most superficial layer is the external oblique. Most superficial is external oblique. It's going down and in. It's like it's aiming towards your pubic region. External oblique. You can see the fascicle is going inferomedially. That's what I mean. It's going down and in, inferomedially. Internal oblique is the next one down, next deepest one. So it's actually in the middle. External is superficial, internal is intermediate in terms of depth. Its fibers are going superomedial, it's going up and in. External, internal. And then transverse is the deepest of the 3. So you can see the 3rd layer here. Transverse, as the name suggests, is just horizontal. So external, internal, transverse. You have 3 sets of oblique muscles. They help, what do they help with? They help with trunk rotation, lateral flexion, as you know, when you work on your obliques. And they also help you flex your lumbar vertebrae. Flex those Z joints. So, bending down, doing a sit-up. Any questions on those 4 muscles so far? What you'll notice about the rectus abdominis is that it's actually kind of deep. The reason why it appears deep is because you have a sheath overlaying your rectus abdominis. This sheath is the abdominal aponeurosis. So we have an epicranial aponeurosis connecting the frontalis, the occipitalis. We have an abdominal aponeurosis, and it's connecting all the obliques together. So here's a cross section. So this would be the rectus abdominis. These are the three lateral muscles. So here's the transverse, external, and internal. The tendons, these aponeuroses, connect all these muscles together. So it's this sheet that's overlying and connecting all the muscles together. The abdominal aponeuroses.
So, you said it, the obliques, all three of them flex the C?
Yeah, all these muscles that I mentioned, they all flex the lumbar sequence, yes. Additionally, they do these other things.
When you're saying lumbar vertebrae,
Lumbar sequence, yeah. Any last questions? Okay, we're going to continue this in lab and look at the actual muscles. So Monday, Wednesday, I'll see you in a bit. Tuesday, Thursday, see you tomorrow. Cut away this muscle that's running up and down right here. We use for chewing. What muscle is this? Medial and lateral pterygoids are deeper than this, so it wouldn't be medial and lateral pterygoids. Masseter. This is your masseter. This one is one of two muscles that extend from the lip region up the zygomatic bone. You see there's one here and there's another here. It's the more inferior of the two. Zygomaticus major. Major is going to be the bigger one. Zygomaticus major, this one's zygomaticus minor. This one's zygomaticus minor. This one's major. Over here we've got on the lateral view, lateral aspect, we've got this large muscle that's extending from the temple bone all the way down to the clavicle and sternum. You can't see that, it's cut off. What muscle is that? Sternocleidomastoid. And then the fourth one is here, attaching from the lower middle lip and then downwards. What is that? Depressor AVI inferioris. It's the muscle that lowers the lower lip. Depressor AVI inferioris. We were going to get more practice with this model and other models today. Most of today is going to be practicing the location of these muscles on either models or the cadaver. I do want to go through briefly the rest of these muscles just so you can see the major functions of all of them, and then we'll get to the other lab and review the rest, like models and cadavers. So, yeah, that's what we're doing today. Are there any questions about these models? All right. We are, like I said, we are continuing to talk about the different muscles. Sorry about the resolution here. I don't know why it's so small. We talk about the different muscles divided that I want you to know. It's not all of them, it's a lot of them though. We're almost done with axial skeleton, and then we'll go to appendicular, and then we'll go in the other room. So most of today's going to be spent in the other room. We just had to clear things up a little bit with because the other practice was set up. We had to cover things up. Any questions before we get started? Cool. Okay. So like we were saying, you have this abdominal aponeurosis. Aponeurosis is just tendon that's connecting muscle to muscle that connects all these different muscles together, all the abdominal muscles together. This very center line, that's called the linea alba. Literally like white line, linea alba. It's a center line that joins all of them together. It's a fusion of the aponeuroses. Linea alba. What kind of connective tissue are these things? Dense, regular. It's tendon, basically. It's a special tendon. It's dense, regular. If you need to move, yeah, go ahead and move. See better. So those abdominal muscles on the whole were used for flexion, to have your body go forward, or I guess press this way. What about for extension, for standing up straight? There's a set of muscles called the erector spinae group, and that's all I'm going to test you on. They are broken up into 3 divisions. I'm not going to test you on those divisions. I just want you to know them collectively as the erector spinae group. They erect your spine. They extend your spine. They also help with lateral flexion. So they help with that too. But as the name implies, they're for extending your vertebrae, extending your spine. These muscles, there's again groups of them. These 3 leader lines are pointed at all of them. These muscles run all the way up and down the vertebral column. And they're fairly deep. To see them, you have to remove the trapezius. You have to remove this muscle called the latissimus dorsi, which I'll talk about in a second. The erector spinae group is deep to all of that. So, erector spinae group and the abdominal muscles, what's the relationship? They're antagonists. They're antagonists. One flexes the vertebral column, one extends it. This really large, broad muscle, the one that swimmers and climbers have really large ones of, like this really large back muscle, this is the latissimus dorsi. Latissimus means very wide, like latitude, very wide, latissimus. Dorsi is referring to your back. Very wide muscle on your back. This muscle we'll see is going to be important for the appendicular skeleton, but it also helps with extension. So it's a synergist. It works together with your erector spinae group. You can't see it that well in this view. If you look, I'll try a different model here. If you look on the anterior side and you were to remove your abdominal cavity and muscles, so you're just looking like what's lining your pelvis, you would see 2 muscles, 2 large muscles. One's called the iliacus, which is in that iliac fossa, the bowl part of the ilium. And then the psoas major, you don't pronounce the P, another silent P. Psoas. Psoas major. There's a psoas minor, I'm not going to test you on it. But these 2 muscles, which are found in that bowl part of the pelvis, the coxal bones, they oppose the erector spinae. So they flex the vertebral column. So like when you lift your leg up like this, when you flex the femoris temporal joint, your iliopsoas muscles are working together. Iliopsoas is a combination of the iliacus and psoas major. So really it's 2 different muscles. The erector spinae, these muscles that are running all the way down the back, and the latissimus dorsi, they converge to a single tendinous material called the lumbar fascia. So this stuff down here, this white stuff down here, is known as the lumbar fascia. The term fascia, tendons are to connect muscle to bone. Aponeuroses are muscle to muscle. Fascia is a similar connective tissue that wraps around all the muscle and also helps it connect. So it's this connecting, holding material very similar to tendon. This is the lumbar fascia down here. It's binding all the muscles to the spinous processes and the transverse processes of the vertebrae. So 2 important sheets of stuff that you need to know: lumbar fascia on the posterior side, abdominal aponeurosis on the anterior side. Yes?
How can you be able to tell the difference by looking at like the anatomy between the aponeurosis and the fascia?
How can you tell the difference between aponeurosis and fascia? Well, aponeurosis is going to be on the anterior side, abdominal side. Fascia is only on the posterior side.
So
Is it always going to be the case? No. This is only fascia. Is this only fascia? Yeah. This is only fascia I'm going to ask you to know. So the lumbar fascia is what's connecting the muscles on the back side. Abdominal aponeurosis is connecting the abdominal muscles on the anterior side.
What was the second one?
abdominal aponeurosis connecting the abdominal muscles on the anterior side. Lumbar fascia connecting the muscles on the back side. Because this is connecting everything. It's muscle to bone to all the other tissue underneath. This is, the aponeurosis is just muscle to muscle.
Is it a white color?
It's the white colored thing.
Is it white colored like actual?
Is it white colored in actuality? Yes. It is white, lightish colored.
Is it dense regular
It is dense regular connective tissue. Oh, here's that better view that I wanted to show you. So here's an anterior view. These are very deep muscles. Most of the skeleton, most of the organs, most of the muscles have been removed. So you can see the iliac crest, and you can see the iliacus attached to that iliac crest. You can also see it going down. What's this feature of the femur called? It's the lesser trochanter. It's attached to the lesser, greater trochanter is right here, lesser trochanter is right here. So from the iliac crest down to the lesser trochanter, that's the iliacus. The psoas major is this longer one, and it starts at the lumbar vertebrae and then goes down to the lesser trochanter. So not only does it stabilize the spine and move the spine, but it also moves the leg. So it does both. Iliacus and psoas major.
Did you say it moves the leg?
It moves, it flexes, well, it flexes the femoral scapula of the hip.
Okay.
Flexes the hip.
And those what people call the hip flexors?
Yeah, when you talk about your hip flexors, what are you talking about? You're talking largely about these. There are a few others, but these are major ones of the hip flexor. Yes. Cool. So hopefully, if I show you a picture and you figure out, practice at home, look in the mirror and work out your different muscles. See, and try to identify which muscles. Sorry? Not specifically these ones, but I'll point to a specific muscle maybe and ask you what. I think I said the mini quiz on Wednesday is on muscles of facial expression. That's what I said. So I might show you pictures of people's faces doing things, and you have to tell me what muscles they use. I'll specify what it is they're doing, but just so you can see it. Take a moment. All right, raise your hands one more time. Hands up, 3. Receive letter, 1, 2, 3. A, yeah. External is for breathing in, which is what you do when you sniff. You're breathing in. B, the rest are for breathing out, for exhalation. One more, take one more. Raise your hand 3 more times. Okay, let's see your hands on 3. 1, 2, 3. On 3, say letter. 1, 2, 3. C, yeah, your traps, your trapezius. Trapezius is for elevating the acromioclavicular joint, among other things. That's one of the things it does. Cool? Okay. Again, I want to briefly go over the next set of slides. This is going to go by quickly because there's just a lot of muscles and it'll be better if you can actually see them in person. So this is chapter 12, appendicular. When we say appendicular muscles, we talked about the pectoral girdle. Does anyone remember which 3 bones were the most important for the pectoral girdle? Scapula, clavicle, and the humerus, yeah. Clavicle, scapula, and humerus. So those are the 3 most important bones of the pectoral girdle. And then the rest of the bones for your arms and hands. And pelvic girdle, that's going to be your coccyx bones. Hopefully that's pretty straightforward. We're going to see what muscles are attached to those bones. Some of them overlap with the axial muscles, so it's really just how you want to define it. Yeah, we'll see what muscles we need to stabilize and move our arms and legs. Why do we need appendages? Because they help us do things, help us move things. If you want to pour a beer, use certain muscles. If you want to dance, whoops. It's not working, that's so sad. Anyways, that thing's supposed to dance. If you want to dance, you need certain muscles. We're going to learn what muscles you need to do these different things. It's really important things. Appendicular muscles move the bones of your arms, your hands, your legs, and your feet. So if you want to stabilize your shoulder, if you want to move your arms and hands, if you want to absorb shocks and jolts as you run, walk, and jump, if you want to strengthen your joints, these are all part of your appendicular musculature. Okay, we've seen the trapezius already, so it's also important not only for stabilizing your vertebral column, but it's also for moving and stabilizing your pectoral girdle. Trapezius, as we saw before, helps you extend your neck. It also helps you rotate your scapula. So all this shrugging motion is your trapezius. It's best seen from a posterior view. Trapezius is best seen from a posterior view. It's a pretty large muscle. You can see it extends all the way up to the neck. It goes to the scapula. Here's that spine of the scapula. And then it extends all the way down, connecting to all these vertebrae. All these cervical thoracic vertebrae. So this is one trapezius, the other is on the other side. Very large, long muscle. If you were, sorry?
It goes all the way to the end of the vertebrae or only thoracic?
It'll go to like the beginning of the lumbar. Like really just like the top thoracic beginning of the lumbar, yes. If you were to cut and remove the trapezius, you will see more muscles underneath. So this will be an important thing to figure out, is this muscle that we're looking at, is it more superficial or is it deeper? So trapezius is superficial. If we cut and remove it, so we're looking on the right side, this is a deeper dissection. You can see more muscles. Here's those erector spinae. So we learned that in the appendicular part, or axial part. These 2 muscles here, shown reflected, there's a smaller one here and a larger one here. Those are the rhomboids. Rhomboids. They have a rhombus shape. A rhombus is this parallelogram. It really should be equal sides, but they're not. These are the rhomboids. If you had to guess which one's minor, is it the superior or the inferior one? This is rhomboid minor, smaller is on top. Rhomboid major, more inferior, it's on bottom. Rhomboid minor, rhomboid major. Therefore, adducting the scapula. Which way is adduction? Is it this way or is it that way? In, adduction, in towards medially or out? Add with 2 D's together. It's in, medially. Add, you bring it together. Adduction, like if you bring your shoulders together like this. Adduction. Rhomboids adduct. Which makes sense. If you contract this, if you shorten this, you're pulling the scapula inwards medially. Pulling the scapula medially. So these are the rhomboids, major and minor. Minor on top. This muscle, so here's the spine of the scapula. Here's the medial border of the scapula. Attached from the medial border up to the neck, up to the cervical region, is the levator scapulae. It raises the scapula. Levator scapulae. Which makes sense. It's on the superior medial portion of the scapula and it goes upwards. So when it contracts, it's pulling up. That's all on the back side, on the posterior side. Trapezius is most superficial, rhomboids and levator are a bit deeper. On the anterior side, the larger muscle is your pectoralis major. We'll get to that later. If you remove and look deeper, you'll see your pectoralis minor. Shown here, attached from your ribs to your scapula, all these pieces here, that is your pectoralis minor. That's, the major has been removed. If you look deeper to that, if you look deeper, deeper to the pec major, you'll see pectoralis minor. So it's these thin muscles here, attached from the ribs to the scapula. They help you protract. You protract your shoulder. Again, that's a deep muscle on the anterior lateralish side, right here. If you go a little more inferior, it looks very similar. It's attached also to the ribs. You'll see these muscles on these lower ribs. Serratus, remember you've all used serrated knives to like cut steak or something? It's jagged. Serratus anterior are these jagged looking muscles on the anterior side here on the ribs. It's more anterior and lateral. Serratus anterior is down here. Pectoralis minor is up here.
Pectoralis minor in the true ribs and the...
Yeah, pec minor is in the true ribs. The serratus anterior goes down to the false ribs. Good. So while pec minor protracts the shoulder, serratus anterior protracts the scapula. So one's the shoulder, one's the scapula. A little bit different. It's different locations. Yes?
Is it also fair to say that the pectoralis minor medially rotates the shoulder?
Does the pectoralis minor medially rotate the shoulder? Yeah, I can do that too. But rotation though, we're going to see that there are 4 muscles that are important for rotation. Rotator cuff muscles, so we'll see that in a minute. But those are going to be more involved in rotation. So all these muscles, they allow movement for, if you're shrugging, you're moving the acromioclavicular joint. If you're rotating the arm, that's craniohumeral. And the sternoclavicular, all these joints are moving when you move these muscles. Cool. More questions? For all these appendicular muscles, I'm showing you exercises that you can do, so hopefully it'll help you envision how you can use them. If you want to use your rhomboids and your traps, you can do this fly motion. When you do this fly motion, you're bringing your shoulders closer together, your scapula closer together. This lat pull down, this pull motion, you're using your trapezius and your latissimus, which we'll get to the latissimus coming out, but to bring down, that's using your trapezius. Serratus anterior, you're using a lot of muscles here when you push up. But when you push up, you're additionally using your serratus anterior because it's pushing on your scapula and your shoulder. Okay, to move your arm, you obviously have to attach to the humerus. If you want to move your upper arm, all these muscles have attachments to the humerus. We talked about pec minor. Here's pectoralis major. Pectoralis major is the larger one, more superficial. pectoralis minor, it's not shown here. Okay, don't worry, it's deeper to this. Here's pectoralis major. Pectoralis major does a few things. It can help you adduct your arm, so help you bring your arms in. It can help you flex your arm. Remember, flexing at the shoulder is this way. Flexing your arm. And medially rotate. So one exercise that you probably all know is either bench press or push-ups. Those are largely using your pectoralis major. On the back, remember the latissimus dorsi? So here we're going over it officially. Latissimus dorsi, these very large muscles in the back, they insert to the humerus and they also attach to the vertebrae. They fuse with that fascia, with the lumbar fascia. They extend the arm. They also adduct, like the pectoralis major. And they also help with medial rotation. So latissimus dorsi and pectoralis major, they do similar things, but one is for adduction. Sorry, they're both for adduction. One's for flexion, one's for extension. A really common movement would be like a pull-up. Pulling up or rowing. Those are, you're using a lot of your latissimus dorsi. The major muscle on your shoulder, the one right here, is your deltoid. And your deltoid helps you abduct, have it go away. Abduct. Right, and then teres major. This word teres means round. So it's the big round muscle, teres major. It's easier, you can see it on both anterior and posterior. It's easier to see from posterior view. So when we look at our cadaver, we're going to see it from the posterior view. We've removed the trapezius. We can see the spine of the scapula, the medial border. Here's the pointy part, the apex. That's where you can find the teres major. It's attached to this pointy lower inferior portion of the scapula, and then to this proximalish region of the humerus. Teres major. It's cylindrical. That's why it's round. Teres major helps you extend. So extend this way, and medial rotation at the glenohumeral joint. Teres major, latissimus dorsi, deltoid, pectoralis major. Again, bench press, you're using your pectoralis major and you use a bit of your deltoid. If you do a pull down, you're using a lot of your latissimus dorsi, you're using your teres major, you're using part of your deltoid, and even a bit of your pectoralis major. Using this type of motion, a lot of your deltoid, and also some pec major. It's really hard to isolate a specific muscle with one exercise. You're usually using a lot of muscles, several muscles to do one motion. Questions on these ones? You may have heard of this term rotator cuff. Rotator cuff muscles are muscles, what they all have in common, they all insert to the tubercle of the humerus, which is all hidden here, but it's inserting into this tubercle, this protrusion of the humerus. They all help stabilize your shoulder, and then, as the name implies, they can also rotate your glenohumeral joint. So there are 4 muscles that belong to this group. If we look on the posterior side, so this is the back view, posterior view. Here's the scapula. Here's the spine of the scapula. There's this muscle that fits above the spine. That's the supraspinatus. Supraspinatus is for abducting the humerus. It helps with abduction. Supraspinatus. That's above the spine. We go below the spine, but not too low. That's the teres major. Below the spine is the infraspinatus. And that's for external rotation. Supraspinatus, infraspinatus. Let me actually go to the back or the front side real quick. Here's an anterior view. If you look behind the ribs, so the ribs have been cut. If you look behind the ribs, but anterior to the scapula, so it's fitting right into that large fossa of the scapula, that's the subscapularis. It's in the fossa of the scapula, subscapularis. And that's for internal rotation. So infraspinatus, which is on the back side, that's for external rotation. Subscapularis is for internal rotation. Back to the back side, the posterior side. This is the teres major, which is the most inferior one. When it attaches to the this is the humerus. Teres major attaches to a tubercle. Sorry, it doesn't attach to the tubercle. It attaches to a part of the humerus that's a bit lower down. The teres minor goes a little bit higher up. Remember, minor is always more superior or more proximal in this case. Teres minor attaches to the tubercle. Teres major does not. So teres minor is part of the rotator cuff muscles. Teres major is not. Teres minor is one of the rotator cuff muscles. Teres major is not. Teres minor also externally rotates the humerus. External rotation. Questions on the rotator cuff muscles? How do you work those out? You're working your deltoid in this exercise because you're bringing it out like that, but you're stabilizing your shoulder a lot. You're using your supraspinatus. To do this side fly type thing, where you lie on your side and bring your arm up, again, you're using your deltoids a lot, but you're also using your teres minor and infraspinatus. I couldn't find an exercise for your subscapularis, but if you want to stretch out your subscapularis, you are stretching out your triceps, which we'll get to, but that's a stretch for your subscapularis. Bring your arm up and pull your arms. All right, now we're getting to the arm and forearm. So to move your brachial region, so basically moving at the elbow, all these muscles insert to the radius and ulna. If you want to move your elbow, move your humeral joint, you have to insert into one of these forearm bones. The one you hopefully all have heard of before is the biceps brachii. Biceps, that literally means two heads. Bi means two, ceps is referring to head. It has two parts. Oh, that's the back, sorry. It has two parts. But we're just going to refer to this together as the biceps. Biceps brachii. You have to say both because there is a different biceps. So biceps brachii, it's a two-headed muscle of the upper arm.
This is the biggest one that we do the...
It's the most superficial one, and so it's the one that you feel when you do this kind of curl motion. It's the one that bulges up. It's the major one that bulges up if you flex like this. So that's obviously for flexing. It also helps you supinate. Supinate is bringing your palm up. Supination. So that's biceps brachii. Brachialis is a little bit deep to it. So you can see the biceps brachii nice and clearly. If you remove the biceps brachii, you'll see the brachialis a lot better. So it's deep to the biceps brachii, brachialis. It's also for flexing at the humeral joint. Biceps brachii, brachialis is deep to that. What's a bit more inferior, a bit more distal, it's the muscle that's on this, like on your thumb side, your radial side. It's this muscle that bulges up on your forearm. That's your brachioradialis. It extends from your brachial region to your radius. Brachioradialis. Shown right here. That's also for flexing. All these things flex your elbow, your humeral joint. So all these flex what do you need to extend? To extend, the major one is your triceps brachii. Biceps meant there are 2 heads. Triceps, there are 3 heads. So that's on the back of your arm, the posterior side. So to extend your arm, that's your triceps brachii. There's one other muscle that helps move at this joint that I want you to know, and it's actually best to see from the anterior view. It crosses over from this proximal medial portion of your arm more laterally and more distal. Crosses over like this. Sorry, right here. This muscle right here. This is called the pronator teres. Pronate, which way, what are you doing with your hand? Putting it down. Pronation. Teres, I mentioned what that means. What does teres mean? It means round. It's a round pronating muscle. Pronator teres. Extend from this medial proximal portion, lateral distal. It's crossing over like this. When it contracts, close your forearm over like this. There are 2 heads to the biceps brachii.
And do we have to know which one is?
No, I'm not going to ask you that.
Where's the third head for the triceps?
Where's the third one for the triceps? It's hiding. It's deep to this. You see 2 right here, but yeah, the other one's hiding. So, how do you work these muscles out? Bicep curls get you biceps brachii as well as brachialis and brachioradialis. To do your triceps, it's you can push-ups work that out, pull downs, or this exercise, or what do you call that? I don't know what to call it. And then you can just go like this, works out your supinator or pronator teres. There's another muscle called the supinator, but I'm not going to ask you to know that. Okay, last set of muscles that I want you to know for the arms. What's going on? That's weird. I'm going to look computer today. Last muscles that I want you to know for the arm are the ones that control movement of the wrist. So there are 3 muscles that are on the forearm that I want you, on the anterior forearm that I want you to know, and 3 muscles on the posterior forearm that I want you to know. There's a ton of muscles there, but I want you to know 6 total in the forearm. Okay, here's your.
It's working now.
Yeah, I can't draw from, so it's probably better if I use this. Great. Okay, great. So we just saw the biceps brachii, brachialis, and brachioradialis. The brachioradialis does extend into the forearm, into the antebrachial region. So here's the brachioradialis. But there are these 3 muscles that are more medial to it. 1, 2, 3 that I want you to know. In order, there's the flexor carpi radialis, which flexes the wrist and attaches to the radius on the radial side. Flexor carpi radialis. The middle one, the one that runs straight through the middle, is the palmaris longus. It's a long muscle that extends to the palm. You can see it. Very few of you may not even have this muscle. You can tell if you have the muscle if you make this motion, this clasping motion with your fingers and wrist. You'll see a tendon pop up in the middle. That's the tendon of your palmaris longus. Anyone not have it? There's a small percentage of the population that does not have it. Why would you not have it? Because this muscle is really weak, so it really doesn't do a whole lot, but so some people just don't have it. I don't know. But if you do have it, the tendon pops out in the middle here when you make this motion. Flexor carpi radialis, palmaris longus, flexor carpi ulnaris is on the ulnar side. So I want you to know these three muscles. There are more forearm muscles. On the anterior side, these are the three I want you to know. Flexor carpi radialis, palmaris longus, flexor carpi ulnaris. At the base of your wrist, what's holding all the tendons in place, that's called the flexor retinaculum. It's this connective tissue that's holding all the tendons together in place. The flexor retinaculum.
That's holding all three of those muscles in place?
It's holding the tendons of those muscles in place, yes.
The muscle, so it's in that head, is the same, the middle muscle,
The muscles in the hand are different muscles. So that's on the anterior side. If it's on the anterior side, that's for flexing. If it's from the posterior side, what do you think they're for? Extending. So let's look at these muscles that are needed for extension. Following a similar pattern, there's three that I want you to know. Here we're looking at the posterior side. Again, here's the brachioradialis, so it does extend down to the forearm. From the brachioradialis, we can then see three muscles. Here's brachioradialis. Right next to the brachioradialis is extensor carpi radialis longus. There's an added word here. Extensor carpi radialis longus. There is a brevis. There's a short one. So this is the extensor. It's an extensor. It extends the wrist. It's on the radial side, and it's got a really long tendon. If it has the word longus in it, think really long tendon. So the palmaris longus has a really long tendon. The extensor carpi radialis longus has a really long tendon.
Wait, which one is it? It looks like the same as the brachioradialis.
Yeah, it's right next to it. So this is brachioradialis, and then this thinner one.
Oh, okay.
Yeah, it's right next to it. So from the thumb side, from the radial side, we go extensor carpi radialis longus. This middle one here, is the extensor digitorum. It extends the digits. So on the anterior side it was the palmaris longus because it went to the palm. On the posterior side it's going to your fingers. So this is extensor digitorum. And then the third one over, so extensor carpi radialis longus, extensor digitorum. Then this third one, which is slightly deep, this is extensor carpi ulnaris. So the pattern we see on the anterior side is similar to the pattern we see on the posterior side. And these are the three that I want you to know on either side, so 6.
Basically the green ones you mark.
The ones that I've highlighted as green are the ones I want you to know, and they're also in bold here. And they're on your study guide. It's all there. We had a flexor retinaculum at the base of the wrist to hold the tendons down on the anterior side. On the posterior side, we've got a extensor retinaculum. Flexor retinaculum, extensor retinaculum.
Are those bands of fascia?
Yeah. A lot of muscles, right?
A lot.
Yeah, let's, in a minute, we're going to go. In general, what you've hopefully noticed is that if it's on the anterior side, it's for flexing something. If it's on the posterior side, it's for extending something. It's generally true here for the arm. For the leg, it's kind of the opposite. It's generally true. If it's on the anterior side, it's for flexing. If it's on the posterior side, it's for extending. Yeah, we're going to go there in a minute. We also want to point out, you still should know all the bones. Remember when we look at our hand, our carpal bones form a curve. So it has this tunnel here. The carpal tunnel is this bony arch of our wrist that protects those tendons that we just mentioned, of those muscles, as well as the nerves. So the carpal tunnel is protecting the tendons and muscles, and here you can see the flexor retinaculum extending from the hamate to the trapezium. If you have carpal tunnel syndrome, that means you're pushing on this flexor retinaculum. It can only protect so much because there's no bone here, and you're compressing these tendons and nerves, causing pain, causing inflammation and pain in that area. Okay, this is a good stopping point. Let's go see. Pack up your stuff. We're going to go to the other room. Raise your hand a few more times. Okay. Answers on 3. 1, 2, 3. Hands. All right, talk it over your group real quick. 1 minute. Go ahead. Again, starting here and bringing your arm out this way. External rotation. Here and here. Prepare for forehand. Forehand's this. So prepare you come back. Start here, and you're extending here. Good. Take yourself. All right, one more time. Let's see your hands. 1, 2, 3. On 3, you say letter. 1, 2, 3. C. Infraspinatus helps with external rotation, lateral rotation. You're bringing your arm out. It's lateral rotation, external rotation. That's the infraspinatus. Lateral rotation. Okay. We've covered a lot of muscles today. We've gone over muscles of the face, your vertebral column, all that stuff from the exoskeleton. We've done the arms, the pectoral girdle. We just have muscles of the pelvic girdle and lower limbs, the legs. So we're looking at what moves the thigh, what moves at the thoracoacetabular joint, what moves at the knee, the patellotibio-femoral joint, and the feet and toes, so at your tarsals and extending your toes and things like that. I showed you all this, so this is what you saw in the cadaver room already. If we have time, we're going to go back one more time, but we'll see. This is what we saw already. We saw 4, well, we couldn't see one of them. There are 4 different muscles of the gluteal region. The first muscle doesn't have the word gluteus in it. The first muscle mentioned here is called the tensor fascia latae. Why is it called that? There is a fascia called the fascia lata somewhere, and I'm not going to test you on it. This muscle tenses it, the tensor fascia latae. It's found, what's the best view of it? Here's that iliotibial tract. It's found up here connecting to the ilium. So it's this muscle right here. The tensor fascia latae. Just one running on the side of your leg. The gluteus maximus is the largest muscle of your butt. Gluteus maximus. So here it is from a lateral view. Here it is from a posterior view. You can see that it's slightly inferior compared to medius. So medius goes along the highest part of the crest. Maximus is a bit more medial. That's a little confusing. Maximus is a bit more inferior. Medius goes to the highest part of the crest. So here's maximus. Here's medius. Both gluteus maximus and the tensor fascia latae. Here's the tensor fascia latae. Here's gluteus maximus. Their tendons converge onto a single piece called the iliotibial tract. You may have heard of it called the IT band. It's the same thing. The I and the T stand for iliotibial. I want you to know that what it stands for. Iliotibial tract. It goes all the way down to your tibia. So it runs all the way down your leg. Pretty long. Very strong. Tensor fascia latae extends your knee and also laterally rotates. Gluteus maximus extends and laterally rotates at the hip. So it extends your hip and laterally rotates. Gluteus medius and minimus, they're deeper to the maximus. So here you can see all three. Here's a cut maximus. Here's a cut medius. Minimus is deeper to that. So it's really small. Gluteus minimus. These are for lateral rotation. Medius and minimus are for medial rotation, turning your leg in, as well as abduction, bringing your leg out. Where's minimus connected to? It's connected in the fossa of the ilium. And Kira, what's this feature of the femur called? Greater trochanter. Connecting the greater trochanter. Sorry, the posterior. The alid is just refers to the flat portion of the ilium. It's just that way alid. So yes, the posterior alid. Posterior alid. So these are four muscles that I want you to know in the gluteal region. Tensor fascia latae, gluteus maximus, gluteus minimus, gluteus minimus. Four muscles. The iliotibial tract is a tendon. Again, workouts that you do, lots of leg stuff. Extending your leg out, abducting, or if you're strong enough, you can do something like that. Maybe twist. Yeah, it works your abs too, of course, but it also works your tensor fascia latae. All right. So a lot of these muscles, gluteus medius and minimus were for abduction, for bringing your leg out. To bring your leg in, we have adductor muscles. There are four muscles. There are four muscles for adduction, ADD. And three of them have the adductor name, just like there are three gluteal muscles, there are three adductor ones. Let me draw this out because it's kind of confusing. If we're looking from an anterior view, here's the head of the femur. There's the femur, I guess. Okay. The largest, let me go to the middle one first. Adductor magnus. Magnus means big. It's the large adductor muscle. Adductor magnus. It's big in the sense that it connects is all adductor magnus. That's where magnus. Of the three muscles, it's the biggest, and it's actually the most posterior. So layered on top of that, we have another muscle, adductor brevis. Adductor brevis, as the name implies, brevis means short. Like to be brief, brevis means short. It's shorter because it's more proximal. It connects right here. Connects to the pubis. So the pubis should be here. So magnus is big and deeper if we're looking from the anterior side, so it's more posterior. Brevis is shorter because it's connecting to the connecting more proximally. And then,
Covering the magnus.
sorry? And it's covering the magnus, yeah. And longest, it's longer because it connects more distally. So this is a longer muscle. Longus. So there are three muscles that have adductor in this name. Adductor longus, it's longer because it's connecting lower down, or more distal. Brevis, more proximal, and more posterior. It's a magnus. One more muscle found in your medial thigh. This is all medial thigh. A long, thin muscle. It's graceful. It's a long, thin muscle. It's the gracilis. This thin, straight muscle right here. It's the gracilis. They all add up. Longus also medially rotates. Gracilis also medially rotates. Both the knee and the hip. Also helps flex the knee, so it doesn't have some other function. No uncommons are there for adduction. Questions on the adductors? Okay, gone over the butt muscles, we've gone over the inner thigh muscles, the medial thigh. What about the anterior and posterior thigh? You probably have heard of names for these groups of muscles. What's this big group of muscles on the front of your thigh? These are quadriceps. Quad means there's 4. Back here? Hamstrings. Those names can be useful, but I want you to know the names of the specific muscles in those groups. I'm sorry. To work your adductor muscles, you can do side lunges, squats, you hit all those muscles. Oh, sorry, one more thing. You saw this earlier when we talked about axial muscles, but they're also part of the appendicular skeleton. Because, yeah, they're attached to the lumbar vertebrae, but they're also attached to the femur, of course. Yeah, to the femur. So, iliacus, again, is lining from the iliac crest down. So it's this one fitting in the bowl. And then psoas major is attaching to the lumbar vertebrae down to the femur. Iliacus and psoas, they flex at the hip. So, like doing leg raises or something. Leg raises, yeah, like that. That helps you work your iliopsoas. Yeah, so you could say that. So what you're flexing the trunk and you're lifting, you're flexing at the hip. So both.
So like you're gonna
A V up and like a jackknife type sit up, yeah. Take a moment before I get to the rest of the muscles. Raise your hand a few more times. Answers on 3. 1, 2, 3. Cool. Here's the letter. 1, 2, 3. for adduction. You bring your legs together, that's adduction. The rest can abduct or do something else. Okay, the quadriceps and the hamstring. Let's go to the quadriceps first. You can call them, all together they can be known as the quadriceps femoris. It's in the femoral region, and there are 4 of them, 4 heads. But we didn't go over the names of the biceps or the triceps, those different heads, but these are distinct muscles, and I want you to know all those names. Okay, let me try to draw this out here. So if this is your femur, again, all right, here's your femur. I'm not going to go in the order that it's listed here. There's a muscle that's right in the center. That's right against the bone and right in the center. And on either side, you've got more muscles. This is the medial side, so you have one here. And then you have the lateral portion, and there's another here. All 3 of these muscles, they start with vastus. Vastus meaning another word for big, vast. You have vastus medialis, it's most medial. Vastus intermedius, it's intermediate to the 2. And vastus lateralis, it's most lateral. When you look at the cadaver, one really helpful thing is that the iliotibial tract runs right along the vastus lateralis. It goes right on top of it. It's right here. So the iliotibial tract runs on top of the vastus lateralis. The major muscle of your quadriceps, the one that's most superior, or superficial I should say, it's covering the intermediate, so you can't see it normally, is the rectus femoris. The rectus femoris is on top, superficial to the vastus intermedius. Rectus femoris. So it's one sitting here, in the middle or on top. Rectus because it's straight. Rectus because it's straight. Femoris because it's in the femoral region. All 4 of them help you extend your knee, help you extend at the tibiofemoral patellofemoral joint. Rectus femoris also helps you flex your hip. So, like lifting your leg up, rectus femoris helps with that as well. Recall that the tendon for the rectus femoris, here's the quadriceps tendon. It continues, it connects to the patella, and then that continues on to the patellar ligament. It's why if you do that knee jerk reflex, you tap the patellar ligament, which stretches the tendon, which then causes this muscle to contract. To keep your leg up. What's the receptor that detects that stretch? Muscle spindle. A muscle spindle. So to work out your rectus femoris, here's that jack that I talked about, Jess. You're working the iliopsoas, the abs, as well as rectus femoris. Squat jumps that you're working a lot, most of your quadriceps to push up and jump up, extend your knee. The back of your leg, posterior side, that's your hamstrings group, but I do want you to know the individual muscles. There were 4 for the quadriceps, there are 3. There are 3 for the hamstrings. If we're looking at a posterior view, let's say of your, we're doing the right leg, so let's do the right leg. So here's the right femur. You've got three muscles. The major one is the most lateral. The major one is the biceps femoris. You have a biceps brachii, it's a two-headed muscle in the brachial region. You have a biceps femoris, a two-headed muscle in the femoral region. So it's the most lateral of the three. Here's biceps femoris, it's lateral. And we're looking from a posterior view again. Biceps femoris. Next to the biceps femoris are two muscles. One is a bit deeper and flatter. One is a bit deeper and flatter. It's membrane-like. That's my mnemonic to help me remember. It's deeper and flatter, it's membrane-like. It's called the semimembranosus. It's deeper and flatter. Lying right on top of it and is thinner and is tendon-like is the semitendinosus. Semitendinosus. Membranosus is wider, flatter. Semitendinosus is long and thin. Superficial. They all help flex the knee. Quadriceps extend the knee, these ones flex. So one way you can work a hamstring group is doing these thrusts, these hip thrusts, as well as these leg curls and regular hamstring groups. Here's one muscle that's really interesting because it's long and it extends from one part of your leg to another. It starts here at this top pointy portion of your hip. What's this called? Anterior superior iliac spine. So it starts there. It starts at the anterior superior iliac spine. It goes down and then medially to your tibia. So it connects up all the way down to your tibia. So it starts anterior, then goes medial and all the way down to your tibia. This is called the sartorius. That word sartorius is a sartor is a tailor. So it's like tailors cross their legs when they do their work, or you feel like you're measuring your inseam. So think of it that way. It goes down your inseam. And it allows your legs to cross over. It allows you to cross your legs, your sartorius. So it flexes your hip. It helps you abduct your hip. It helps you laterally rotate your hip. We can talk about a lot of muscles that medially rotate. This one laterally rotates. When it contracts. Sartorius, long, thin muscle that the gracilis looks very similar to the sartorius. Gracilis is only on the medial side. You only see it here medially. Sartorius is longer and crosses over it. Starts anterior, then goes medial. So they look similar, gracilis and sartorius. But look for the longer one that starts anterior and crosses medial. You do bicycles, you can work your sartorius. That's another example of what you can do. Take a moment. Raise your hand a few more times. Okay. It's your hands. So 3. 1, 2, 3. Talk it over real quick. Find some other different answer. It's one of your quadriceps muscles. Your quadriceps muscles are for extending your knee, for kicking your leg out. If you can't do that, then it has to be one of those. It's your vastus lateralis. The rest, like biceps femoris, that's your hamstring. That's for flexing, not extending. It's a tricky one. A deadlift is where you start. You start here. You're not squatted fully. Your knees are slightly bent, maybe if you wanted to be. But you start here, and it's at the hip. Come up like this. So it's not. You're not bending the knees. You're not moving that. It's all at the hip. You start low. Thrust up.
What kind of stance is this?
Huh?
What kind of stance?
Start here. This isn't using your back muscles. I mean, you're not supposed to use your back muscles when you do this. Right. Basically, what I'm asking is which one do you need to thrust your hips out?
All right. Oh.
It's your hands. Up. Talk it over real quick. Go ahead. Talk it over.
Do I need to stand up and do
Okay, one more time, please. Hands on 3. 1, 2, 3. 5. On 3, say the letter. 1, 2, 3. D. D, yeah. When you do a deadlift, you're working your hamstrings. When you do it properly, you're working your hamstrings. When you flex your hips up, like this motion, you start here and your hips thrust up. A deadlift is just the vertical version of that. You're working your hamstrings. Questions? All right, almost there. Last muscle is of the leg. Just like how we went over certain muscles of the forearm, we're only going to go over certain muscles of the lower leg, of the peroral and visceral regions. So here we're looking at the anterior side. There are 3 muscles I want you to know on the anterior side. Just like there are 3 on the anterior forearm, there are 3 here on the anterior side of the leg, the peroral region. The most obvious one, feel your tibia, and now just feel a little lateral to your tibia. The one where you get shin splints. That's your tibialis anterior. Tibialis anterior. It's on the anterior side of your tibia. Just the anterior lateral. It's shown right here. Tibialis anterior. When you contract it, it dorsiflexes, brings your toes up, dorsiflexes, and also helps you invert your foot. Dorsiflexion and inversion. So here's that pattern of 3 again. Tibialis anterior, the next muscle in, which is kind of deep and long. It's got a really long tendon. This is the extensor digitorum longus. If you don't have the longus, what are we talking about? Remember, this is an extensor digitorum. Extensor digitorum is in the arm. Longus is in the leg. Extensor digitorum longus. So this is extending your phalanges 2 through 5. There's a different one for your big toe. We're not going to go over it. That's one. Tibialis anterior. Extensor digitorum longus going through your toes. The one most lateral, which makes sense, is the fibularis longus. It's on the fibular side. This is for plantar flexion, pulling your toes down, and eversion of the foot. So it's the opposite of tibialis anterior. These are antagonists. So 3 on the anterior crural side. There's only 2 on the, oh sorry, I'm going to show you this first. You can work like the bands to work with the eversion and inversion of your ankle. And it's just another view of your extensor digitorum, how it connects to your toes. 2 muscles in the back. They're major muscles. So these are the muscles you need to use when you like do a calf raise. The big muscles that when you flex your calf, the big round muscles that you see, that's the gastrocnemius. Gastrocnemius. It's got a funny name. Gastro, when you see the word gastro, what do you think of? Stomach. These are bellies. These are bellies of the gastrocnemius. So, if you were to remove the gastrocnemius, so this is where the gastrocnemius is removed, you see it's cut here, you can better see the soleus. So the soleus is deeper. The soleus is deeper and longer. It runs all the way down to the ankle. It's deeper, longer, flatter. They work together. They're both for plantar flexion, for doing the calf raises, doing the tibia toes. Both of these converge to a single tendon, just like we went over the gluteus maximus and tensor fasciae latae converge to the iliotibial tract. Both gastrocnemius and soleus converge to the calcaneal tendon, which you probably know as your Achilles tendon, but I want you to know the technical word. It's connecting to the calcaneus, to that bone here, the heel bone. That's what that tendon is. So obviously if you cut this, like if you down to this like Marcus Cousins or Kobe or a ton of other people, if you down to this, you can't really walk. You can't plantar flex here. Those are all the muscles you need to know. That's it. We'll practice it again next time, Wednesday. We're going to have more time to practice everything that we just did today. We're going to do the same thing. And we'll also learn about nervous tissue.